The Division of Sports Medicine at Boston Children's Hospital is a comprehensive multi-center program that really focuses on the treatment and prevention of sports-related injuries in patients of all ages, from children to adults. The young athlete's not a little adult athlete. There are real differences. Anatomic differences, there are physiological differences, there are psychological differences. Our specialists are trained not just in sports medicine, but also in pediatrics, and I think that's essential for the proper care of the younger athlete. Within the Division of Sports Medicine, we're multidisciplinary, and within that multidisciplinary nature, there are physicians with very unique skill sets and specialization. If you're a lacrosse player, you can find the guy who takes care of more lacrosse athletes than anyone else, and that's the same with dancers, figure skaters, runners, football, etc. The four pillars of our program in sports medicine are clinical care, research, education, and treating sports injuries out in the community. We're team physicians for over 20 high schools, 10 colleges, universities, the Boston Ballet, Boston Marathon, USA Track and Field, and USA Figure Skating. When we see a patient, we can treat their injury, but we can also focus on what was the underlying cause of their injury. Is it their alignment? Is it their mechanics? We're thinking about getting their motion back, their strength back, so they're fit and ready to go back to sports, not getting them back too soon. We're trying to work with them in terms of their psychology. Are they psychologically ready to return to sports? We can offer them both surgical treatment that's state-of-the-art and non-operative treatment that's state-of-the-art. Literally, for many of these conditions, we've written the book. We're developing procedures to take care of sports injuries in kids. We're developing rehab protocols to better rehab these injuries, prevention protocols. Locally, regionally, nationally, and internationally, we're sent these patients. And I think, like anything, the more you see of a problem, the better you get at the diagnosis, treatment, management, whether that's non-operative or surgical. All that translates back into taking great care of that patient, watching them get better, return to the sport and activity they love, see how that has a big impact on their life, I think is very rewarding.